78% of that board comes from business. And I don't mean candy store business, I mean BC Hydro, I mean Terrace Gas, I mean BC Transmission. These are big business people who understand the bottom line. You know more about healthcare than they will ever know about. And so, you know, treat them gently from that point of view.
These plans continue to focus on people as our #1 priority. And continue with the integrated approach to the 4 system.
Excuse me, Vern. Excuse me. Can I please remind the audience that this is an active hospital with people under care, and that outburst does not serve healthcare well. Thank you.
We commend Kim Carter, the Ombudsperson for BC, for recognizing the value of family councils. In the first part of her report, The Best of Care, Getting It Right for Seniors, 10 worthy recommendations, clearly defined and outlined. However, the government has only accepted and acted on 4. We say all 10 should be accepted and implemented. We say family councils should be encouraged and embraced as early warning consultants and advisors. We say that these dedicated volunteers should be valued and respected instead of being viewed as adversaries by the Vancouver Island Health Authority. Thank you. We say family councils must remain independent, voluntary committees. And we say there's a desperate need for an independent seniors representative. Yay! We say there's a need for whistleblower protection to reduce the fear of retribution so everyone feels they can speak out.
I'd like to start that sentence over again since you enjoyed it so much. These plans continue to focus on people as our #1 priority and continue with the integrated approach to the 4 system-wide initiatives, as well as the key results areas identified by the Ministry of Health Services and the Ministry of Healthy Living and Support. That concludes my report, Mr. Chairman.
Thank you, Vern.
Remember this word, privatization? Forget it. We don't want to hear that word anymore. It's coming throughout all of our health care in BC and we want it to stop. And it's coming throughout the seniors' care right now. We've seen this in Kamloops. We've seen it in Quesnel. And you know we've seen it all up and down this island and what it's doing to the care for seniors. Now we're told by the ministry, private facilities don't cost any more than non-profit. Oh, well, what nonsense. Like, what does private mean if it doesn't mean profit, eh? So what happens? Then the services, if the services are the same, then the care will be compromised. And that means private makes profit by compromising the care. And VIHA leads the province in turning residential care over, no doubt about it. We know from research done in both the US and Canada that tells us that care delivered by for-profit agencies is inferior to the non-profit sector. Studies in both BC, Manitoba have found that the profit facilities send more seniors to hospitalization than others. There is usually lower staff levels, you know that, you're there. Less RN care and monitoring, and less physio and OT staff. So when privatization happens, one of the first results is, and we've already heard it, the contracting out. And what happens in that? The care aides, the dietary and housekeeping services all seem to go. Lower wages mean higher turnovers, we've already heard that, and less time with residents puts them in a increased distress situation.
In January, we had a number of members from the US-based Centre for Health Design Research come visit us in Victoria and to give us their perspectives on the new building. They were very impressed with how we've designed our building and believe that as a result of our design, patients will recover faster and will spend fewer days in hospital. They also were specifically impressed by the close to 85% single patient room ratio that will be available to the population in the Patient Care Centre. And only last week, our partnership was again recognised internationally, where the Patient Care Centre in the Royal Jubilee Hospital won the Best International Project at a prestigious London-based P3 infrastructure competition. This new building is being recognised as the best in the world, and we at VIHA couldn't be more proud of that achievement.
Very briefly, a message to Howard Waldner. Howard's a Scotsman. I heard on the radio this morning Scotland is rapidly reversing its privatisation process because it doesn't work. It's bringing cleaners back in. It's bringing cooks back in. So maybe Howard should go back to Scotland for a refresher course.
Last year, we announced the redevelopment of 2 of our residential care facilities on South Island, one at Oak Bay Lodge and one at Mount Ptolemy Hospital. The board issued an RFP last year, and that RFP, that's a call for proposals, closed at the end of February. I'm pleased to announce today at the board meeting that after a thorough evaluation process, the board today received a recommendation from executive, and a lead proponent was named with whom we will work to try and negotiate a contract. So the board have determined the selection of Baptist Housing, a non-for-profit housing provider with a long and proud tradition. It's a non-for-profit society that's been in operation for over 46 years as the preferred proponent in partnership with the Lark Group and the Capital Regional District.
And what happens in 2 years, or 3 years, or 10 years, or 35 years if Baptist Housing Society decides to sell the lands? What happens if they, like the Kiwanis, decide to get out of the seniors' care business? There will be absolutely nothing to stop them turning around and selling these precious public lands, and we won't be able to say anything about it. They'll be privately owned.
On March 26th, VIHA issued an RFP for housekeeping and food services that are currently provided by Compass Canada. We had originally, see, this is a very popular set of issues. We had originally negotiated a 5-year contract with an option for a further 5 years with our current provider. We did, however, retain the option to return to the market and to test whether or not the Compass agreement still represented the best value for money after the initial 5 years were complete. And that's exactly what we've done by exercising the option to go to tender at this point, to market test.
And the board, you know, the board aren't bad people, I don't think. But some of them must have a conscience about what they're doing. If you get a chance, tell them, you know, to go out into the long-term care homes. Don't just sit and listen to the CEO. Go out and see what's really happening. And if you've got a conscience, resign. Because you can't change the government's mind, but by resigning and letting the public know where the board has gone wrong, you will do a service to healthcare. Thank you.
Oh, right, Doctor. David, thank you.
I'd like to remind the folks who are here that the responsibility for running the hospital operations at St Joe's rightly rests with the board and the administration of St Joe's. Our responsibility is to fund St Joe's in line with our community hospitals. And some of you may be aware, but some of you clearly are not aware, that last year VIHA and the board of St Joe's commissioned a joint report by a company called Corpus Sanchez to review the relative funding levels between St Joe's and other sites across VIHA. And as a result of that review, we provided an extra $4 million of additional funding for St Joe's in the last fiscal year. So I can now assure this board and everybody present that St Joe's is absolutely funded in line with all of the other community hospitals operated in VIHA. And how those funds are used is for the determination of that board to determine.